Hello and welcome back to GP Video Podcast by Nadia. So today I would like to talk to you about a topic which is a bit unusual. It's called triple whammy. I'm not sure if you guys have heard about it or not, but triple whammy basically means if a patient is on 3 medications, which I'm going to tell you which sort of medications and which group of medications, if they are giving together to a patient for any reason or any purpose, they can actually cause acute kidney failure. This medication combination is called triple whammy. So people who have chronic diseases or are on multiple medications, when I tell you about these groups of medications and the names of the medications, please go back and check if your GP has, or sometimes what happens is it's not the GP who prescribes all of these, it's the different specialists without knowing the list of your medications. So that is why it's very important for your GP to have a complete list of your medication every time you visit him or her, so that he can find out whether you are on a triple whammy or not. And yes, so that is our topic for today. So as I said, that it's very important for you to always have a complete list of your medications that you take, and you can divide it into the regular medications that you take daily and the PRN medications or as needed medications. So that's very, very important to do, because drug interactions are usually seen when you have a complete list of your medications and not incomplete. And always put a copy of it in the car. If you are going to a specialist, if you're going to your GP, you always have that updated medication record so nobody misses anything. Because even the reason that specialists miss it is because they don't have a complete record of it. So now I will tell you about triple whammy. So the triple whammy is a dangerous combination of drugs that can lead to acute kidney injury. It occurs when a person takes angiotensin converting enzyme inhibitors or angiotensin 2 receptor blockers. What are these medications? These are the blood pressure medications like candesartan or valsartan or perindopril. So these are the medications. There are other medications as well in this group, but these are the examples. So like candesartan, valsartan, telmisartan or perindopril. These are the angiotensin ACE inhibitors or ARBs, angiotensin 2 receptor blockers. So number 1. Number 2, with diuretics. So diuretics like furosemide or thiazide diuretic, hydrochlorothiazide, these are also usually used in combination with other blood pressure medications, or these are given to people who have got edema or fluid collection in the body because of heart failure, kidney failure, or liver failure, or any other reason that a specialist or a GP puts you on it. So a combination of ACE inhibitors, diuretics, and number 3 is non-steroidal anti-inflammatory drugs or NSAIDs like Nurofen, which is ibuprofen, celecoxib, and all the medications of this group, diclofenac sodium, all of that. So NSAIDs, angiotensin ACE inhibitors, converting enzyme inhibitors, or angiotensin 2 receptor blockers. You will be on either one of them. You can never be on both of them. So either one of these with diuretics, with NSAIDs. So if you are on this triple whammy, or if you are on a combination of these 3 medications, the GP needs to take an action, and he needs to remove one of these, which is least used or least needed. Sometimes what happens is that people are on regular ACE inhibitors and diuretics and take NSAIDs as needed for pain. That can be allowed, because NSAIDs anyways you can't take more than, let's say, 14 days in a row maximum, because NSAIDs can cause stomach ulceration. They are not that good for heart, so they are not a long-term medication anyways. So usually I have seen the patients are on ACE inhibitors and diuretics on regular basis for blood pressure and for fluid retention. management, and then they take NSAIDs on and off. But I am then very careful in giving them NSAIDs as a way of pain management, because anyways NSAIDs is not good in chronic diseases, like it's not good for kidneys, it's not good for heart. So we try and steer clear of NSAIDs. But if it's really needed for taking the inflammation down, then I would rather use corticosteroids for 3 to 5 days, or if we have to use it, just for 3 to 5 days again, to prevent from acute kidney injury. So people can have chronic kidney injury and they are on diuretics, and then when they suddenly go on they can be on diuretics and they can be on ACE inhibitors when they have chronic kidney failure, for kidney management and for blood pressure management and fluid management. But when they are put on NSAIDs as well, then they get acute on chronic renal failure. So that's why we have to be very careful, and we have to steer clear of triple whammy. So make sure every time you see your specialist, you see your GP, you see any doctor, you have a complete list of your medications. You get your medications reviewed every time, especially by your GP. The doses, the strengths, the names, the purposes, the regularity, everything needs to be checked. So today it was all about triple whammy.